Good morning. I want to welcome you to our press briefing with updates on COVID-19. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders, and first, we'll hear from City of Albany Mayor Bo Durrell.
Thank you, Chief. Good morning. As many of you are aware, a team from the Centers for Disease Control and Prevention came to Dougherty County last month to conduct a rapid community assessment. The CDC team generated a report, and I will take this opportunity this morning to share some of the more significant findings with you. As of April 27th, 22% of the county's residents had been fully vaccinated, and 26% had received at least one dose. 34% of the white population and 21.5% of the African American population had received at least one dose. Over 80% of those who are 65 and older had received the vaccine, whereas less than 6% of those between the ages of 18 and 24 had been vaccinated. The report confirmed there is an adequate supply of vaccine and commended healthcare professionals and community leaders on their efforts to date. The CDC team identified various obstacles to increased uptake, which simply means increasing the number of citizens being vaccinated. These include reluctance due to suspicions about the vaccine, typically associated with concerns about the relatively short period of time in which the vaccine was developed, and/or misinformation. A belief among some individuals who have had COVID-19 that they have an immunity and cannot be reinfected, and a general distrust among some of healthcare institutions. Some residents expressed a reluctance to be vaccinated as they had been informed they would continue to need to wear masks and maintain social distance even if they were vaccinated. The report recommended that time and resources be committed to promoting the vaccine in the Hispanic community, as the CDC team did not have sufficient time to adequately engage with these citizens. We're aware that the mass vaccination site operated on Oak Ridge by GEMA closed after only a few weeks. The mass vaccination site at Phoebe HealthWorks is now open only 2 days a week and is scheduled to be suspended later this month. The decision is primarily the result of a sharp decline in the number of citizens who are taking advantage of the opportunity to be vaccinated. Another reason is the increase in the locations to include pharmacies, private physician practices, and clinics where people can be vaccinated. The CDC team made several recommendations which are being implemented. Phoebe Putney has 2 mobile units, which will be deployed to various locations throughout the county in the coming weeks. We are aware that the vaccine has been administered in certain neighborhoods where residents have only limited access to health care. Local ministers are working with Phoebe Putney to have pop-up sites at various churches. One nonprofit organization, CORE, has dispatched a mobile unit to the Southwest Georgia Health District and will be working with Dr. Ruiz and his staff to expand the locations where those living in small towns and rural areas can be vaccinated. The report further recommends that there be mass communication efforts in the form of flyers, emails, public service announcements, and press conferences to assure citizens the vaccine is safe and effective, and to better publicize the opportunities and procedures for being vaccinated. One interesting recommendation is that individuals with influence among young adults be enlisted to persuade those in this group that they should be inoculated. The report also recommends a boots-on-the-ground strategy, which would involve calling and texting those who have not been vaccinated and even going door to door in certain neighborhoods. The CDC team emphasized it is important that simple, consistent messages be communicated to the public and that these messages be repeated frequently in the coming weeks. Additionally, those who are reluctant to be vaccinated should be offered the vaccine at locations where they are comfortable, be it churches or community centers, such as the YMCA and the Boys and Girls Clubs. We are appreciative of the efforts of those in the healthcare community and are in the process of enlisting trusted voices to encourage others to be vaccinated. It is incumbent upon those of us who have been vaccinated to persuade family members, friends, and coworkers who have not taken the opportunity that they should do so. Thank you.
Thank you, Mr. Mayor. We will now hear from Dougherty County Commission Chair Christopher Cohelas. Mr. Chair.
Thank you, Chief. Thank you, Mayor. I'm going to be very direct today. We are seeing something in our community that we're seeing across the nation, which is we're seeing vaccination hesitancy. We are seeing the overall number of vaccinations plateau. We're seeing that in our community as well as across the state and across the United States of America. And there are a certain percentage of Americans that just simply don't want to get the vaccination, and everyone has their own right to a personal choice. We also are seeing in Dougherty County that we're approximately about 2% lower than the rest of the state of Georgia in terms of vaccinations. And I want to put some numbers with that. In Dougherty County, as of today, 47,789 vaccinations have been administered. Of this 47,789, 26,239 have received at least the first dose. That's 29% of the population, while 22,045 have been fully vaccinated. That's 25% of the population of Dougherty County. I say all of that to say this, because we're only 2% lower than the state average, but we still have a lot of citizens that still need to be vaccinated. But I want to say this: we are remarkably unique in terms of Southwest Georgia, the state, Southeastern United States, the country, and the world. We were number 3 in the entire world in terms of infection. We brought tremendous amounts of resources to this community so that we could deal with the death, the devastation, the tragedy that gripped this community, that made us feel different than anyone else. We brought tremendous resources here. We've brought a mass vaccination site. We have had Phoebe working very hard to do that, to do vaccinations en masse. We now are seeing a plateau. And frankly, we have defined ourselves as being very resilient, very tough, very smart, very disciplined, and overcoming much of what this virus has done to the rest of the country and to us, and done to us in a way that's unimaginable. It's unimaginable to actually be in a position to have to request a mobile morgue at one time for us to be able to store all of the bodies that were here in our community because we were dying so fast. And so I say all of that to say this. I'm not saying it to be depressing, but I want us to remember where we came from and how we defined ourselves through the tornadoes, through the disasters, through the hurricanes, through COVID-19 at the beginning and the middle. We're not at the end. And what we can do is continue to define ourselves and raise the percentage. Instead of being 2 points behind the state average, I would much prefer that we be 10 points ahead of the state average. Let's lead by example. Let's do the things that we know need to be done. I challenge our thought leaders in the community, our clergy, our business leaders, our business owners, the people that have influence in our community, I challenge you to challenge the folks that you're responsible for. I challenge the fathers and the mothers of this community, the people that have spheres of influence, to encourage people not only just to get vaccinated because it's a good decision for them, but because you're giving back to this community, and you're giving back to a community that has been through so much. And I think it's important for us to remember how we felt back in March and April of last year in order to determine where we don't want to be and to define where we want to go. I think it's very important to be realistic and to think about those things, because I've said this 1,000 times, and I'll say it 1,000 more times if I need to. This is a marathon, and it's not a sprint. You have to put in the hard work day in, day out in order to accomplish what we need to accomplish for our community. Because even though our death rate has gone way down, even though we have far less people in the hospital, every death is too many. And the fear that continues to grip this community and other communities across the country, like, it's not normal to feel this way. And the only way that we continue to heal ourselves is to make sure that as many people have immunity as possible. And everyone has the right to make their own personal choice as it comes to the vaccination. But what I would challenge people to do is to think about this. Once they're vaccinated, you have confidence. You have confidence that you're far less likely to transmit the virus. I know that it's still a possibility, but it's far less likely to transmit the virus, way less likely to get the virus. Taking those probabilities and adding them up, it produces a recipe that's far greater and far more likely to produce success, less deaths, less people in the hospital, and less people on respirators. And I think that's what's important for us to continue to cling to during this time. Thank you.
Thank you, Mr. Sherman. We will now hear from our representative from Phoebe Putney Memorial Hospital, Dr. James Black, who is the chairman of the emergency department. Dr. Black.
Thanks, Chief. Good morning. I'll give some of our numbers. As of this morning, Phoebe, we have 25 COVID-19 patients in our main campus and 6 in Americas. Our numbers continue to be relatively stable, hovering around the mid-20s up to about 30. Now, on the one hand, it's pretty good news, and our numbers are showing are much lower than they have been during our surges, but on the other hand, it's relatively stable, showing that this disease is persistent in the community, and we're likely to be dealing with this for some time, especially if more and more people don't get vaccinated. In the last couple of months, though, we've noticed a concerning trend of younger COVID-19 patients. And early on last year, our average coronavirus patient that was hospitalized was 65 or a little bit above 65. Over the last month, though, our average age has dipped down less than 50, and now it's shown a steady trend every month of going down. Now, it's due to a couple of factors. Number one, as we talked earlier, our vaccination rate among our seniors has been much more robust than it has been for the younger age groups, and I'll hit those in a second. Let's see. Another thing I want to talk about is the pre-existing conditions and the effect that it has on people for their susceptibility to getting COVID-19, but also the rate of severe disease when they get it. So we talk about one of those 6 pre-existing conditions: obesity, diabetes, high blood pressure, congestive heart failure, COPD, and asthma. So now anyone can end up getting sick from COVID-19, but it's important to know that people with these pre-existing conditions have a higher risk of complications due to that. Some of the things we want to mention here, we talked about our vaccination rates in the community. 83.6% of Dougherty County residents 65 and older have gotten at least 1 dose of the COVID-19 vaccine. That rate is 48.1 for those aged 55 to 65, and then for those under 55, that rate is 33.6. And as you look at that number throughout the age spectrum, each younger and younger age group, the number gets smaller and smaller, showing that our younger residents have not gotten out to get the coronavirus vaccine at a rate that we would like to see that. Just to let you know, just as the state is drawing down its mass vaccination sites, we're winding down the operation at our larger sites. But at the same time, we're increasing the number of places that you can get vaccinated to make sure it's accessible and available to anyone who would like it. We're offering vaccine at all of our primary care offices throughout Southwest Georgia. We're taking them on the road with our mobile wellness units. Just yesterday, one of those mobile units was at the drug take-back event in Albany. Tomorrow, one will be at the New Oak Free Will Baptist Church in Newton from 12 to 2, and the other will actually be in the Staples parking lot in Albany from 10 to 4. Next Saturday, we're going to party with Doherty Fresh initiative to provide the vaccines at the Spring Festival in Riverfront Park. And starting next week, we'll be giving vaccinations at our community care clinics and our urgent care centers. Cancer patients, can still get their vaccinations when they come to Phoebe Cancer Center for treatment or checkups. Our corporate health department is working with various employers to provide vaccinations at their workplaces. And of course, these vaccinations are always available through the health department, other providers, and pharmacies. The bottom line is, given our numbers and our experience here, the vaccines are readily available. We know they work. We're still encouraging everyone to roll up your sleeve if you haven't already. Anyone who wants to get a vaccination out of one of our Phoebe primary care centers can call 229-312-MyMD. That's 229-312-6963 to schedule an appointment. And again, I want you to encourage to wear your masks when you're in groups of large groups of people, or if you're in the company of someone who's having symptoms, or if you're having symptoms. So please wear your mask when at all possible, and continue to wash your hands, continue to social distance. Everyone be well. Thank you.
Thank you so much, Dr. Black. We will now hear updates now from the Director of the Southwest Georgia Public Health District, Dr. Charles Lewis.
Good morning. I want to talk a minute about herd immunity. Loosely put, herd immunity is that state, it's that condition where the number of susceptible people to a particular infection is so low that the infectious organism doesn't really have any place to go. So in this case, when we're talking about the COVID-19 virus, when we have herd immunity, we will have such a small number of infected people that the virus just can't get to a fresh victim, and it essentially will cease to exist. Well, we are not at that point. That's where we want to be, and we would prefer to get there through vaccination and not through widespread infection. But we're not there, and I can say that with confidence because the number of new cases in Doherty County continues to climb. Now, the good news is that the rate at which it is climbing is showing a slowdown. Over the past month or two, each week, the number of new cases was going up in the neighborhood of 20 or 30%, and sometimes even 40%. So about a week ago, that the number of new cases over a 14-day period extrapolated to 100,000 population was 142, and then this week it was 147. That's an increase, but a small amount of an increase compared to previous weeks. So that's encouraging news. Once we see that rate going down, if we can keep it going down, at some point we may in fact reach herd immunity. Most communities in Southwest Georgia have a new infection rate that's considerably lower than Doherty County. Most communities in Southwest Georgia have a new infection rate somewhere between around 40 and 100. So we're not happy with the number, but we can get that number down if we work together. Chairman Cohilas did a great job of talking about the vaccination rates in Georgia and in Dougherty County. Just to reiterate, 25% of people who live in Dougherty County are fully vaccinated, while 29% have had at least one vaccine treatment. In Dougherty County, the Dougherty County Health Department has administered 9,800 doses of vaccine. Throughout the Southwest Georgia Health District, our staff has administered over 63,000 doses of vaccine. It has been said before, and I'll reiterate that the senior citizens have done a good job of getting the vaccination. So if you can see the slide that we have showing here, you'll see that folks who are 65 and older, for the most part, over 80% of that group has been vaccinated. But if you look at younger people, the rate of vaccination sharply falls off, and the younger you go, the younger that rate is. So in public health, and I would dare say that throughout the healthcare field, we're aware of this, and we're trying to take steps to encourage younger people to get vaccinated. One thing we're doing is we're trying to get the messaging out through standard media, through social media, and every way we can think of to try to educate folks, to help them understand the dangers involved from COVID-19. It is a clear and present danger now, and to help them understand that there are things that we can do to turn the situation around, and getting a vaccine is really number one right now. We are very hopeful that the CDC will, and the FDA will extend the use of the Pfizer vaccine down to teenagers, or down to children between 12 and 16. Currently, using the Pfizer, a child of 16 or 17 can get the vaccine. They're currently eligible, and we're hopeful within the next couple of weeks we'll see that expand down to those who are 12 years old. So getting a vaccine is really easy. Every county in Georgia has at least one health department. Every one of those health departments is administering the vaccine. Most hospitals are administering, pharmacies are administering. Here in Dougherty County, Phoebe Putney is doing a great job of offering the vaccines. Most physician practices are offering it. And we do have also CORE, the nonprofit organization that is here in Southwest Georgia. They started vaccinating this week in multiple locations. On Tuesday, they were in Sylvester, Georgia. Wednesday, they were here in Albany, where they provided vaccines at the Sandtrap Lounge. Yesterday, they were in Moultrie, Georgia. Today, CORE is vaccinating in Warwick, Georgia, which is on Highway 300 northeast of Albany. So if anyone lives in or around Warwick, or if you're traveling through Warwick, Georgia this afternoon, and if you have not been vaccinated, please stop by and get your vaccine. It won't take very long. You do not need an appointment. The location is in downtown Warwick at 111 Dogwood Street at the court building. They will be there between 1 and 5 p.m. today. Tomorrow, CORE will be at the Littman Cathedral tomorrow morning, and then tomorrow afternoon they will be back at the Sandtrap Lounge. And please, if you haven't been vaccinated, please consider any of these options. And if you have been vaccinated, perhaps you know someone in your family or in your circle of social acquaintances, please be willing to encourage those who haven't been vaccinated to go ahead and take that step. And the last thing I want to do is just to review the reasons to get vaccinated, and some are clearly obvious. If you get yourself vaccinated, it will help protect you against a deadly disease. If you're vaccinated, then you're much less likely to spread the virus to someone else. So by getting vaccinated, you actually protect those in your family, other people that you care about, and the entire community. Those statements are true for the virus that is currently in the community. But I want to focus for a minute on the fact that viruses change. It's their nature to change over time. So the longer a virus is in the community and circulating, then that means the more opportunities that it has to make genetic changes. Some of those changes that occur may not have much of an effect on the infections that they might cause. A genetic change in a virus may not make it more deadly, it may not make it more contagious, but it very well could. So the virus that we have among us now is bad enough, it's deadly enough. But if we don't stamp it out, if we let it hang around and continue to infect 147 people over a 14-day period on and on and on, then we run the chance that someday this virus is going to mutate into something that is far worse than anything we have seen. The virus that we've dealt with up to this point has caused tragedy among our population. I would suspect that everyone personally has known someone who has died from COVID-19. If you think about it, many of those folks have been middle-aged or older. The younger folks have been largely spared from COVID-19. But just imagine what our community, imagine what your life would be like if 6 months from now or a year from now, this virus mutates into a form that not only will kill middle-aged people and adults, but what if it kills children? We have some choice in this matter. We can let the destiny and nature control us, or we can use the tools that we have and do the responsible thing and get vaccinated, and then we will be in more control of our own destiny. Please give this some consideration. If you'd like to talk about this in more depth, please call your local health department. We'd love to talk to you about the benefits of getting a vaccine, the safety of it, the effectiveness of it. In public health, you now have your choice. If you want a Moderna vaccine, we'll give it to you. If you want a Johnson & Johnson vaccine, both have their advantages. We'd love to help you out. Give us a call if we can help. Thank you.
Okay, thank you, Dr. Ruiz. We'll now hear from the Dougherty County Coroner, Mr. Michael Fowler.
Good morning. I don't want to repeat some of the things that the mayor and the chairman have already spoken, along with Dr. Ruiz and Dr. Blight, but I want to encourage you, as Dr. Blight was saying, most of the death that I've dealt with had some underlying medical condition, the hypertension, diabetes, COPD, or some kind of underlying condition. So I want to encourage the one that the chairman have said to consider getting the vaccine. We want to save lives. Then a lot of times, people may not die, but the complication they have after they overcome COVID-19, they have some other issues that go on. So we will encourage you, if you can, consider that very serious. At this present time, May the 7th, we have 281 deaths. The death rate definitely have declined. Since the last press conference on April the 23rd, we've had just one death. We was at 280 then, now we're at 281. Looking at the chart from January 2000 this year, January we had 41, February we dropped down to 17, March we dropped down to 5, April we had 3, and for May we just have 1. Death rate definitely helped decline. So we want to encourage you to keep doing what you were doing, wearing masks, practicing social distancing. I wish we'd have started earlier. The more life that probably possibly could have been saved if we would have started back in March and April of last year. But now I want to thank the different ones that have taken the vaccine, especially the 65 and older. I want to thank the different ones that are wearing masks now. At one time, so many of us not wearing masks, but the ones that are not, I want to encourage you to wear a mask, especially if you haven't had the vaccine. So again, like I said, we have come a long ways, but we're not out of the water yet. So I want to encourage you to keep doing what you need to do, masking up. Again, thank you. We just one death in the last couple of weeks. Thank God for that. Thank you.
Thank you, Coroner Fowler. We will pause now for any questions from the media. Okay. Ms. Broughton, any from our social media side? Okay. I'd like to announce that we will have a scheduling change in our press briefings. We will begin to move to once a month press briefings, and we will announce the day and time very soon. So this will conclude our press conferences for this month, and we'll announce a date and time for next month. So thank all of you for being with us today. Remember to continue to mask up. Social distance is still important. Keeping surfaces clean, those frequently used surfaces clean, and just follow the advice of the doctors and people we've heard from today. Thank all of you for being here. The press briefing is adjourned.